Hello, everybody. In this video, I'm going to talk about one of the most important issues that you need to consider when you are conducting your research and reporting the results of your study through a standard medical article, which is informed consent and how to obtain informed consent from the participants of your research. Informed consent is necessary for all research involving humans. So any study that you are doing on human, even if it is a clinical trial or any observational study, you need to obtain informed consent from the participants. Informed consent is based on a very important principle in research ethics called respect for persons, which means that you need to give the participants of your study all required information about the purpose, about the method of the study, about the risk associated with the study, benefits of participating in a study, and any alternative is if available for the intervention that you are going to do so that the subjects understand this information and can decide voluntarily to participate in your study or not. And this process must be done prior to the conduct of the research. So you cannot start your study unless you ask for informed consent from the participants. And this is the responsibility of the principal investigator or the person who is the head of the research team to ensure that the consent process is followed. There are some principles that you need to consider when you are asking for the informed consent. The first principle is that this consent must be given voluntarily. It means that any factor and any issue that can affect voluntariness of participating in your study should be eradicated and should be excluded. We know that some university professors do some studies and ask a student to participate in their studies, or some employers may ask employees to participate in their studies, or some, for example, commanding officers may ask the members of the military to participate in the study. There are always some power imbalance between these people. So it is possible that some employees think that if they don't participate in the study by the employers, there may be some hazardous effect, or if some students are asked to participate in research by the university professors, they think that if they don't participate in the study, it may affect their marks or so on. And the same is true for members of the military when they are asked by the commanding officers to participate in this study. All these power imbalance should be excluded, should be explained in the REB, and should be emphasized that participation in the study is all voluntarily and there is no undue influence. We know that there are some people that are in prison, and it is possible that some studies are done in prison. So these prisoners may think that there might be some punishment if they are asked to participate in a study, but they don't. So this is a very critical issue, and this is something that should be explained in the protocol of the study, and REBs should be aware of the nature of the participants, and if there are among those people who are in prison, uh, there should be some explanation on how the voluntariness of participation in the study was maintained. Uh, for some research, there are some incentives given to participant to participate in the study. These incentives, the amount of these incentives shouldn't be that large and attractive that can affect the willingness of the participant to disregard the risk of participation in this study. So, if, for example, you are doing a study on uh, homeless people or some poor people, and the amount of incentive that you consider to giving them is too much, it may be a reason that they disregard the risk of participation in the study. So all these issues should be explained in the protocol, and should the REB be confident that participation in the study is all voluntarily, and no one against his or her will participate in the study or are obliged to participate in the study. The second principle that you should consider is that the participants of your study can withdraw from the study at any time. You explain the risks, the benefit, and the method of the study to participants. They are happy to participate in your study, and but after some while, after a while, they don't want to continue uh, to your study. They must be free to be withdraw from the study, and if they want to withdraw from the study, they have every right to withdraw their consent about using their data or human biological materials. So, in addition to withdraw from the study, some people may let you to use the data that you gathered at that time. Some other people may not give you the consent to use those data or human biological materials. And this is their right, not to uh, let you use the materials or data that you have already gathered. It is possible that in some projects, the withdrawal of data or human biological material may not be possible. In these cases, the reason why withdrawal of data or human biological materials may not be possible should be explained in the protocol, and REBs or Research Ethics Board of your university or institute should be informed, and they should approve that people can withdraw from your study, but their data cannot be withdrawn. So this is something that transparently should be mentioned in the protocol of your study. The next principle that you need to consider is that informed consent is an ongoing process. Some people think that if they talk to participants and they consent to participate in a study after listening to the aims, to the benefits, and to the risk of the study, this is valid informed consent for the whole process of the study. This is not true. While they are happy to participate in your study, it is possible that during the process of study, some new risks or side effects are reported by patients or participants, or some alternative treatments are introduced in the literature. So you need to get back to the participants, inform them again about the possible alternative treatments or possible side effects that happen for some patients, and ask them to again confirm that they are willing to participate in your study. So anything that can change the process of your study, for example, changes in the decision-making capacity of the participants, need another approval. For example, you are working on some uh, participants during the process of conducting your study. Some of the participants or patients uh, lose their consciousness. So you need to approach to the next of kin or to the parents of the children, ask them for confirming that they are happy to continue to the study. The next principle that you need to consider when you are conducting your study is performing and conducting a study on children or cognitively impaired people. For children, you need to ask for the informed consent from the parents or from the guardians of the children. And for cognitively impaired people, if the protocol of the study is in a way that you need these people to be included in your study, you need to talk to the next of kin or the third party that know about the willingness of these cognitively impaired people and ask for their informed consent. So you cannot start doing or conducting research on cognitively impaired people without the consent from their next of kin. Another issue is that while I told you that you need informed consent from the parents or guardians of children, if these children are in an age that they can understand the aims, the risk, and the benefits of participating in your study, if these aims, risks, and benefit are explained to them in a language that they can understand, then you need the assent from these children as well. So, in addition to informed consent, you need the assent. You need to talk to these children in a language that they can understand and ask for their willingness to participate in a study. You cannot oblige a 13-year-old teenage to participate in your study just because their parents are happy with that. You need to talk to them and ask for their assent. For a very younger children, for example, for a 4-year-old children who may not understand what exactly you explain to them, informed consent from the parent may be sufficient. How we can document this informed consent? Preferably, we need a written informed consent. You explain the situation to the participant and ask them to sign a written consent, and this is the best thing that you can do. However, in some situation, it's impossible for written informed consent. Because, for example, some people are illiterate, they cannot write, they cannot sign. In these situations, verbal consent can be appropriate and can be acceptable if it can be documented properly, and preferably if it can be in the presence of a third party. In some cultures, handshaking means that the participants are happy to participate in your study. It is very dependent on the context. In some context, exchange of gifts can be acceptable based on that context that you are conducting your research. In any case, the procedures used to seek consent must be documented properly, and research ethics board should be aware of the process that you've done to ask for the informed consent. Some studies are done through the questionnaires. You send some questionnaires to people, ask them to fill the questionnaires, and return those questionnaires back. Those participants or those people who don't want to participate in your study will not return the questionnaires. But those who return the questionnaires, this return of questionnaires can be considered as an approval action uh, for participating in the research. And this is considered as some type of consent. In some situation, research ethics board may exempt informed consent. For example, if the research involves no more than minimal risk, if the alteration to informed consent process is unlikely to affect the participants' welfare, or sometimes it is impossible or impracticable to conduct the research and to address the research question properly if the prior consent of participant is required. In all these situations, REBs, Research Ethics Board, ethics committees, or any regulatory body of your institution or university must be aware of the situation, and they should evaluate this study case by case. And in case of this alteration or change in the informed consent process, the precise nature and extent of any proposed alteration should be defined, and you need to have the approval of the REBs or ethics committee for this exemption from informed consent process. And you need to mention to the journal that you are going to submit your study that this study was exempt by the REB, and it is possible that the journal asks you for providing the written exemption from informed consent process by the REB. So you cannot just write in your study that, for example, because this study involves no more than minimal risk, no informed consent was required. You need to approach to your REB. They need to evaluate your protocol, and they need to approve the exemption and you need to have a document at hand if the journal that you're going to submit your article to wants you to provide that exemption. Here I want to share with you some examples from the journals published by the IMR Press. The first example was from an article submitted to the one of the journals, and in this article, in the section related to ethics approval and consent to participate, it was written that this study was performed in line with the principles of Declaration of Helsinki. Approval was granted by the ethics committee of XXX, for example, university or hospital, with a waiver of informed consent. However, there was no documented waiver of the informed consent. And my colleagues at the IMR Press asked the researchers to provide the documented material, but they didn't have, and they had to get back to the RAB and ask for the exemption. In another example, which was related to another article published in one of the other journals affiliated to IMR Press, entitled Clinical Comparative Analysis of Severe Fetal Growth Restriction Complicated with Preeclampsia. In this study, the authors clearly mentioned that the research was approved by ethics committee of the affiliated Suzhou Hospital of Nanjing Medical University, and they clearly mentioned that given the retrospective nature of the study, which involved only the review of existing medical records without any direct patient contact or intervention, the requirements for written informed consent was waived by the committee, and they could provide the related exemption from informed consent approval. And this is a good case that you can follow for any similar studies that you may have. REBs may allow some studies that involve medical emergencies without the consent of participants. So it's possible that the nature of your study is on patients in emergency room or patients who are unconscious. In these situations, if you explain these situations to the RAB, they may consider your case and they may give you approval to perform a study without informed consent if the prospective participant is unconscious or lacks the capacity to understand the risks, method, and purposes of the research. And next of kin or third-party authorization cannot be secured in sufficient time despite documented efforts, which means that you have done whatever you could to find the relatives, find the next of kin, ask them for informed consent, but you couldn't find those people and you had to start your study. In this case, RABs may give you the permission to do that, but later on, as soon as these patients regain their consciousness, or as soon as you could find the relatives or next of kin of these patients, you need to approach to them and ask them for their informed consent. And it is possible that at that time they don't give you the consent, and you cannot use the data that you have gathered at that time from those patients. So in other occasions, it is possible that some individuals have signed a research directive indicating their preferences about future participation in research in case they lose capacity or upon death. In these situations, researchers should be guided by these directives. So if you have already talked with some participants that in case of death, for example, or in case of losing capacity, whether you want to participate in our study or not, and if they have given their consent to you, if these instances happen, you can continue with performing your study, conducting your study based on what those patients or participants mentioned before their death or losing their capacity or consciousness. 2 points about ICMJE recommendation about informed consent. International Committee of Medical Journal Editors recommend that the requirements for informed consent should be included in the journal's instruction for authors. You can exactly see such a thing in all journals published by the IMR press, that anything that you need to know about informed consent and which studies need informed consent should be clearly mentioned in the journal's instruction for authors. And when you ask people for informed consent, if you've done a study that needs informed consent, you need to indicate in the uh, manuscript submitted to the journal, and when your article is going to be published, the journal should mention in the published article the process of informed consent and whether this informed consent was approved or exempt by which research ethics committee, and all these issues should be clearly explained. Thank you very much for being with me so far. If you have any questions or comments, please share those with my colleagues at the IMR Press. And next to the, looking forward to the next video with another ethical issues to be discussed. Thank you very much.